Conversations from the World of Allergy, a podcast produced by the American Academy of Allergy, Asthma, and Immunology. I'm your host, Rebecca Sapp. Today's edition of our podcast is focused on the recent AAAAI WAO Joint Congress in San Diego. We wanted to highlight all the fantastic talks at the meeting, as these are now available virtually. If you were there, this gives you the opportunity to catch talks you may have missed. And if you were unable to make it, you have the chance to enjoy the talks and benefit from all the education that was available. The theme was climate change and allergic diseases, global impact on health. And the focus was on how we as allergy immunology specialists can be the experts on how climate change is impacting our patients. The theme was chosen by the immediate past president of the AAAAI, Dr. Paul Williams. It is the culmination of a year of initiatives within the AAAAI around this theme. Here's Dr. Williams with his thoughts on the meeting.
You start as president-elect developing the initiatives that you're going to have during your presidency. And then you spend your time during your presidency trying to make sure that things are going with their initiatives. In the past, a lot of times presidents have developed task forces to work on individual things. My approach is a little bit different. I use the existing academy committee structure to institute my initiatives, and a lot of them related to the environment. I was able to develop the theme of the meeting as the environment and climate change, and so everything just worked together really well. The sad thing is that when we get to the meeting, which is kind of the climax of your presidency, you're busy with other meetings with the World Allergy Organization or the European Academy, and so you don't get to see a lot of it. This year it's been great because I got to moderate the presidential plenary, and I thought that was great, and the attendance was great, and I've had good feedback on that. I got to moderate the keynote address, and that was very nice, and got good feedback on that. And then people stop you in the hall and say, "Hey, great meeting," you know. But the purpose of the initiatives and was to train the allergists to be the expert on environmental change. And so that's how I see this moving forward, is people take the information they've learned from this meeting and continue to be an advocate for the environment and also an expert on taking care of patients who are impacted adversely by the environment. So that's really kind of neat.
As in the past, there were a number of special sessions, including the discovery session, that focused on basic science research. This was sold out and was well attended. The research presented at the discovery session was focused on mechanisms of type 2 inflammation, and the feedback was that there were great discussions about the underlying pathology of allergic disease that is moving the field forward. By keeping the session small, it allowed for more discussion and connection, which is so important for moving the field of science forward.
My name is Patrick Brennan from Brigham and Women's Hospital in Boston. For me, the highlight of the AAAAI this year were the discovery sessions. This is a basic science programming where everything is related to allergy, or at least type 2 inflammation. This makes it unique in the research community. There were a number of really outstanding talks this year. In addition, the poster sessions were phenomenal. Probably some of the best poster sessions I've seen at any scientific meeting. Overall, this was a great way to bring the PhD researchers and the MD scientists together to work on things that are really relevant to allergic disease. I can't wait for next year's sessions.
My name is Erin Steinbach from UNC. My highlight of AAAAI was at the discovery session. The poster sessions in the evenings were really fantastic. They had such a good energy and lots of people asking questions, and I was able to network and get really good ideas about my research, and so that really energized me for the rest of the meeting.
The AAAAI hosts a program to help interested medical students and residents explore the field called the Chrysalis Project. The program is limited to 60 participants, and there have been a record number of applicants the last few years. In order to open up to more people, the didactic sessions on Friday and the career session on Saturday were available to all medical students and residents attending the meeting. There were over 100 attendees at both sessions, and the speakers really engaged with the audience, allowing the participants to choose their own adventure in immune deficiency or share the top 5 reasons to study drug allergy. They also shared their own career paths and the importance of mentorship. There was great feedback, and it is exciting to see the development of the next generation of allergy immunology physicians.
Hi, I'm Ria Chu. I'm at the Medical College of Wisconsin in Milwaukee. And one of the highlights of the program this year has been really the Chrysalis program and being able to be involved in reaching out and teaching the next generation and just showing them the passion that we have for our allergy immunology field. The other thing is that I really enjoy just kind of connecting up with the folks that I haven't seen for the past year. So it's been really great.
Hi, I'm Hillary Clavel. I'm an internal medicine and pediatric resident from Indiana University. I think my favorite part about coming to this meeting, being part of the Chrysalis Project so far, has just been being able to meet like-minded individuals who are interested in allergy and immunology, who want to maybe allow this to shape their career going forward, but also learning about specific medications, specific immunotherapies that are out and about, and really just being able to be exposed to all of it in one.
The plenary sessions were well attended, and if you didn't have a chance to attend, I highly recommend you check out these talks. The talk on Friday focused on environmental influences on the microbiome, and on Saturday discussed how to adapt our field to climate change. Sunday's talk discussed vaccines and respiratory viral infections, and it's exciting to think about the impact vaccines are having on preventing these diseases and how it will help our patients. We're currently seeing the benefit of preventing RSV in infancy through the vaccine, and I'm looking forward to seeing more research in this area. On Monday, the plenary focused on changes to asthma management and the incredible options for care that are now available to our patients, and the need for more therapies in certain subtypes.
Hi, my name is Anna Wolfson. I had a great time at the Academy meeting this past year. I found it really interesting to learn about climate change, and I really enjoyed reconnecting with my colleagues from around the country and the globe.
This is Carla Davis. I am Secretary Treasurer of the Academy, and this meeting has been fantastic. One of the highlights that I would say of my experience at the meeting was the plenary, the presidential plenary on environmental influences on the microbiome and the impact on allergic diseases. Learning about how the virome is really dysregulated in people who have atopic disease, and how it influences bacteriophages and the microbiome. That was just incredibly fascinating, and I think the knowledge that CO2, another highlight, is the knowledge that CO2 really impacts pollen growth and allergic disease was really fantastic. So climate change, after I came to this meeting, I definitely know is impacting my patients.
I'm Nicole LaHood. I'm from Tucson, Arizona. That's where I practice. And I thought that one of the most important things I took away from, well, two of the most important things I took away from the plenary session just now were that, microplastics are something that we keep hearing about and we keep, getting targeted with. And I think that the signal is stronger and stronger every year. And so that's something that I will probably encourage more of, is getting rid of microplastics in the kitchen, especially replacing everything with glass and stainless steel. And I think that's something I'm going to be implementing more and more in my home too, not just recommending for patients. And then the other thing is, how global warming is really affecting our pollen distribution and like mold and fungus distribution. I mean, we see this when I lived in Massachusetts, and also like now where I am in Arizona, and just reevaluating the testing that we're doing and, our immunotherapy antigens that we're providing for our patients, every few years to reflect the changes that are occurring, locally and worldwide.
My name is Craig Platt. I'm from Boston Children's Hospital. I find it particularly exciting that we now have multiple ways to protect infants from RSV infection. Being a pediatrician, I've seen a lot of severe RSV cases. I do find it, there still is an unmet need for patients over 19 months, especially our immunocompromised patients. So while I'm excited that there's this new data and that we'll see much less severe RSV in healthy infants, I still see an unmet need for immunocompromised children.
The meeting also featured sessions on drug allergy, anaphylaxis, chronic urticaria, food allergy, and more. For some, the highlight of the meeting was being able to present their work at the poster sessions and get feedback on their research. And for some, it was spending time learning from all those presenting. Committee meetings brought people together with similar interests, allowing them to learn from each other and consider how to move the field forward and support our patients. And for all, it was a chance to connect with old friends and make new friends. Running into someone you worked with in the past or mentored, or who mentored you, and being able to reconnect is always the highlight of the meeting for me.
I'm Maria Novitskaya. I'm a second-year internal medicine resident at Hopkins Bayview, and one of my highlights was presenting my research on the prevalence of hearing loss in primary immunodeficiency patients at a poster session. And I think through speaking through other people and getting their feedback, I really learned about new avenues we could take our work and how we could improve our work. So that was really meaningful.
I am Dan DiGiacomo. I am an allergist immunologist at Jersey Shore University Medical Center in Neptune, New Jersey. The highlight of my experience at the Quad AI this year was definitely the genetic testing drop-in session. I was fortunate enough to be one of the faculty members who was helping out with the event and had the opportunity to address questions from allergist immunologists across the practice spectrum about how to order and interpret genetic testing. It was very well attended and a ton of fun and just overall a wonderful experience.
Hi, this is Kim Blumenthal. I'm from Mass General Hospital and Harvard Medical School, and I just finished going to the International Drug Allergy Symposium and learned a tip about contrast allergy from Dr. Allison Ramsey, which is that the recommendation for patients with lower risk reactions to contrast would not be to pre-medicate with steroids and antihistamines, but actually you get the biggest bang for your buck if you just switch contrast agents.
Hi, I'm Jim. I'm a second-year PEDS resident, part of the Chrysalis program. One of the things that I was very excited and found valuable to learn about was how to talk to patients about drug allergies, in particular to meeting them halfway there versus pushing your own agenda on thinking like, if their drug allergies are real or not, but meeting them in the middle and trying to compromise that way.
I'm Karen Sue Blattman from Dartmouth, and I really enjoyed the session today looking at the emerging treatments for chronic urticaria, and also actually looking at some of our oldies but goodies and seeing how we can still use that in between breakthroughs of current treatments.
My name is Mark Shaker. I'm up at Dartmouth, and my highlight of the meeting was to hear about neuroimmunology and following up to the January 10th conversations on the world of allergy and the role that we're beginning to understand on how the immune system can be understood in a holistic way, together with the rest of the body. It was fantastic.
Hi, I'm Dr. Nicole Ramsey from Icahn School of Medicine at Mount Sinai. And my favorite things about the meeting in San Diego were connecting with old friends, going to the talk on adverse childhood events and asthma, and thinking about all the different aspects of that talk, and then also the talk on outmatch and thinking about how omalizumab can be used and is potentially superior to multi-food OIT plus omalizumab.
Hi, I'm Dr. Artusa Karosh from the Dallas-Fort Worth area, Holistic Allergy and Immunology, and I really enjoyed the meeting. I particularly liked that there was continued focus on microbiome and immune dysregulation. I enjoyed all of those talks. I loved that the focus on outcomes in social determinants of health was so strongly represented in both podium presentations and posters. I also really enjoyed presenting with my medical student our research on pediatric post-acute neurological syndrome and PANS patients, and I just always find this meeting to be so diverting and stimulating, and I just loved being in San Diego and seeing the water, and looking forward to running in the foundation run today.
The recordings of many of the sessions from the meeting are now available, and hope you will take the opportunity to listen to these sessions and learn from them. CME credit is available through December 31st, 2025, so don't forget to claim your credits. Of course, you can't catch up with colleagues or participate in the Foundation 5K if you're not at the meeting, so I hope we'll see you next year in Philadelphia for the 2026 annual meeting. Until then, look out for your regional or state meetings in order to connect with colleagues and to keep the conversation going.